Howdy. If you are a physician associate, or nurse practitioner, I want you to listen for just a second. I have a subject I feel very strongly about, and that's being called a healthcare provider. We should not call ourselves providers. We have a special bond with patients as clinicians. We should not use the same term that internet cell phone providers or cable company providers use. It's not a business transaction. The term provider is actually an insurance term. And if you use the insurance terminology, there are payers, there are providers, and there are enrollees or covered lives. That's where that term comes from. We want to use healthcare terms where we talk about clinicians, physicians, we talk about health systems, and we talk about patients. Why would you use the term patient from one system to refer to the patient and yet use the insurance term provider to use for ourselves? Even the term is a junkyard term. If you scan the pages of the New York Times or Wall Street Journal, you'll find that all of these entities have been described as healthcare providers. Medicare and Medicaid, pretty much every major health system, and even insurance companies are referred to as healthcare providers. It's a complete junkyard term. But then if you look at who's using the term on an individual basis, when you say see your healthcare provider, do you mean see your chiropractor? Because they're out there using that term. Do you mean see your crystallologist or your naturopath? If we don't define the term, then seeing your healthcare provider doesn't mean anything, and to the public, that can be quite deceiving. We have a special bond with patients. As physicians, there is something called the physician-patient relationship. It's not the provider-patient relationship. It's defined as a legal entity in most states. We need to use the term physician when describing ourselves and not provider. We do our patients a great disservice to use this undefined term. And you say, now wait a second, what about mid-level providers? Well, let me tell you, even nurse practitioners and physician associates don't like that term. It's been well studied and well documented that that term is not embraced by them. So we try and use this inclusive terminology that's politically correct. It's not helping anybody. It's frankly just confusing the patient. We are losing our terminology, and we have medical school graduates who haven't even referred to themselves as physicians. They call themselves providers now, and patients are starting to say the word to my face. We are in danger of losing the word physician, losing the word clinician, and losing the very entity of what we do, turning it into some business transaction that's defined by the business world, which is increasingly putting its thumb on us. Let me tell you this, if you get referred to as a provider, correct them. If you get an email that says you're a provider, correct them. We need to reclaim terminology, and words matter. It's not too much to say physicians, nurse practitioners, and physician associates. It's not too much to say clinicians. It's not too much to say medical staff. There are ways to refer to us besides provider.